Welcome back, everyone. It's Dr. Simmons from VIA again. February is both Low Vision Awareness and Macular Degeneration Awareness Month, so we want to talk about both today. First, let's talk about low vision in general. Simply put, low vision is any situation where your vision limits you from doing the things you want to accomplish. That could include reading, handwriting, cooking, watching TV, and any other task that we used to take for granted. We get a lot of questions here at VIA about the term legal blindness and what does that mean. If a person has reduced vision to a point where they can see no better than 20/200 on a standard eye chart, even with their best glasses, that's what's considered legally blind. Now notice that legally blind doesn't mean totally blind. In fact, most people who are considered legally blind retain a good amount of usable vision. Our role is to help determine our patients' goals and then to work to find solutions to help them return to the activities that they love to do or things that they need to do to help keep their independence. Often, there are special ideas with lighting and lenses that are helpful, and there are vision specialists known as vision rehabilitation teachers who can travel right to people's home to work with them on techniques to improve their activities of daily living. Now let's focus specifically on macular degeneration. In the eye, the retina is like the film of a camera, and in macular degeneration, it's as if we have a hole or a defect right in the center of our picture. Wherever we look, there's that blind spot or distorted area getting right in the way of what we're trying to see. This becomes especially frustrating when we try and see small detail, like reading print, seeing faces, or watching TV. There are two types of macular degeneration that you'll hear about, the wet type and the dry type. In the wet macular degeneration, there are fragile leaking blood vessels under the retina. Unfortunately, when those blood vessels leak, they cause a scar. And a scar in the retina is permanent, and it's an area of lost vision. There are several treatment options for wet macular degeneration, and the most common at this time involves injection into the eye, where we try and seal up the leaking blood vessels. While this does not erase the damage already done, these treatments have proven effective in sometimes limiting the devastating effects of macular degeneration. The other type of macular degeneration is known as the dry type, where there are no leaking blood vessels. In this type, though, the retina has circulation issues and starts to lose function from a lack of nutrition to it and the buildup of byproducts of metabolism that occur in the retina. At this time, there's no cure for dry macular degeneration, and while vitamin and mineral supplementation are often recommended, they're generally found to slow progression at best. So, whether it's macular degeneration or another condition that's making daily living more difficult, it's so important to know that hope is not lost. Even though we can't fix the damage, through special lenses, lighting, adaptive equipment, and training, we can find ways around the difficulties and help make our patients' goals obtainable. Remember, keep seeing your retina specialist to monitor your macular degeneration, and if day-to-day activities are becoming too hard to manage, come see us in the low vision clinic to help you find solutions. Thanks for watching with us today. Follow us for more videos in the future.